So today for my OSCE, I'm doing a respiratory assessment. So I want to first perform hand hygiene. Then I would like to introduce myself to the client. Hi, my name is Connie. I'm the student practical nurse that's going to be working with you today. I'm going to be doing a respiratory assessment. Is that okay? The patient's going to say yes. And I'm going to proceed to do my respiratory assessment. So I'm going to do my assessment in the proper order. So I'm going to inspect, palpate, and then auscultate. So on inspection, I'm looking at the chest. I'm looking for bilateral chest expansion. I'm looking for the shape. Is it an elliptical shape? I'm looking for any kind of abnormalities, or are things kind of equal bilateral? So I would be looking at those things. When I'm feeling, I would feel to get a respiratory rate. And so I could put my hand on the chest and feel for rise and fall, and I could count respirations. And so I would do that for 30 seconds, and then I would have the patient's rate, which would be anywhere between 10 and 20 breaths per minute. Then I would want to go on and I would want to auscultate the chest. So I'm going to listen for breath sounds. So I'm listening to see how their breath coming in and how their breath going out sounds. I'm listening for any abnormal sounds when I'm doing that. I'm listening for in different lobes of the lungs. So when I'm listening on the top part, so this part is our upper lobe, and then everything down in here would be our lower lobes when I'm auscultating. I also, want to go back and talk about when I did the rate would be between 10 and 20. I wanted to talk about the quality, the rhythm, and the effort. So they're good. The patient's taking really good breaths. They're don't look like they're having a lot of difficulty breathing, and they don't seem out of breath at all. So that's good. Once I'm done doing the front of the body, I could have my patient turn around, or I could come to the back, and we can talk about listening to the back side. So when I'm looking at the back side of the chest, I'm looking to see if there's any abnormalities. Is the spine center? Are the scapula kind of in the middle of the hemispheres? Do the ribs look like they're kind of down sloping? So I'm looking at that chest shape, and then I would want to listen to my 8 to 10 spots on the back. And again, I'm just going to have you take a breath in and a breath out. Okay. So again, when I'm listening to the back, I'm listening for them, for their breath in and their breath out. I'm listening for any adventitious sounds, and I'm listening in the upper lobes. And on the back, the lower lobes are a little higher. So upper lobes to about this area, and then the lower lobes. And when I'm on the right-hand side, right here is that middle lobe. So I would be listening to upper and then lower and middle. I'm listening for any adventitious sounds. I'm listening for any crackles or wheezes. I also want to do chest expansion while I'm back here. So I would want to put my hands, I would want to pinch the skin, have them breathe in, and then see if my thumbs separate evenly when I'm doing that, to see if they're getting the same chest expansion on the right and left-hand side. And I think that's all. Thank you.